Two children, Robin, 34, and Jake, 27. Please let's welcome Rich Casey.
First of all, I want to thank you guys because, the Newark Rotary is really one of the very first to support our new Child AIDS Prevention Project. Of all Rotary clubs in this district, you're one of the first. And I want to thank you, first of all, for that. And that was about, I think, 3 years ago, something like that. And I'm glad you still want us to come back. We've had 3 different people come and talk to you over the past 3 years. And what I want to do today, assuming our AV works, you're going to be my beta test group, because this is the first time I've done this presentation. First time I've done it on this setup with an HDMI, and the first time with my new Apple upgraded software. So everything is new, so it's probably going to break. But if it doesn't, what I'd like to get from you is some feedback at the end as to what you liked and didn't like about the presentation, because it's the very first time just premiering here in Newark project in Africa. And then bring you right up to date with a trip I made about a month and a half ago to Liberia on what we call a vocational training team workshop. Let's see. Hey, it does. So here's the basic problem that we're dealing with. There are about 300,000 babies infected every single year in Africa with the HIV virus. And of course, in Africa, with the limited resources they have in medicine, it's a lethal infection. They die within 5 years. It's just not right. And so that's the reason we committed to wipe this out from the world. In America, there are only 100 children every year. It's hard to believe anyone is born with HIV, but this is mainly to women who live on the periphery of society, drug abusers and so forth. But the main reason that women don't give birth to HIV-infected babies in America is because every pregnant woman is tested for her HIV status. And so we know early on what her status is, and we know how to treat the baby. So it just doesn't happen. If we can get all the women in Africa to be tested, it would be a huge step forward. So that's one of the things we're trying to do. Reasons. One, it's English speaking. Remember, this is the country where the American slaves repatriated in the 1820s, 1830s, and kind of took over the country, actually. But for the last, from 1990 to 2003, they were in a vicious civil war that killed a lot of people. And so all the aid from outside countries dried up. The U.S. didn't want to give them any money. UN didn't give them any money. But things now, over the last about almost 10 years now, have settled down because they have a new president, the first female president of an African nation, who you may remember, Ellen Johnson Sirleaf, won the Nobel Prize, Peace Prize, in December. And she got re-elected last November. So things have really settled down. You don't sense all the political turmoil of past years. And Ellen Johnson Sirleaf is a phenomenal woman. So that's why we picked Liberia. It has about 100,000 infected people, and about 10,000 of those are babies under the age of, or children under the age of 5. And ooh, very good, excellent. Because James Monroe was the President of the United States at the time they went back and settled in what became then later known as Liberia. So it's called Monrovia. And their biggest hospital, interestingly enough, is JFK Hospital. So it's a very Americo-centric kind of a country, because in spite of the fact they were slaves, they took many of the customs from its religious order and still maintain it. That's why it's called St. Joseph's. The Brothers of St. John of God actually run the place and support it financially. So this is the approach to preventing babies from being infected with HIV is very simple. The most important are the first two, though, education and counseling. Because, of course, as in many African countries, you're dealing with largely illiterate populations. Trying to, get them to understand what a viral infection is and how if they do certain things, their baby will not be infected. Probably the third item is the most challenging, just getting a woman to agree to be tested. You would think it would be fairly straightforward. A pregnant woman would want to know her HIV status so her baby wouldn't be infected. But if you're in Liberia in particular, where it's still a very male-dominated society, if you come home and tell your husband you're HIV positive, you're out in the street basically. So it's or you're beaten up. So it's a very, very touchy situation. Trying to get the men to come in to be tested has been a very, very major obstacle in Liberia. They just don't want any part of knowing what their status is. But we're working on that. But getting the women tested is a vital part of this whole program we're supporting. And then once they're tested, if they're positive, we have all the drugs we need nowadays to treat the woman for the rest of her life and to prevent the baby from becoming infected. With these drugs, nevirapine, which is just given one time at birth, and with the other antiretroviral drugs, we can reduce infections by 98 or 99%. So it's incredibly effective. The cost is, well, here's some of the drugs, just so it's nothing. I mean, the drugs have become remarkably, and this is for a woman, this $15 is a major part of it. That's for a woman to take drugs for about 3 to 4 months before she delivers, to suppress her viral load, which is the surest way to prevent the baby from being infected. And it's $20. I mean, it's ridiculously low. So we really feel it's a very doable challenge. We can wipe this problem out of the world within the next 5 to 10 years. The Rotary Club of Syncor, and they're our partner, and they're the ones who are on the ground making sure that our money is spent properly and that follow-up, the necessary follow-up is done. So I want, if you continue to support us, I want you to know your money is watched very carefully. And here's some of those Syncor Rotarians that were there, and then me and another Los Altos Rotarian I'll show you a little bit more about later. And then our partner, what they call the collaborating partner, is an NGO called Global Strategies for HIV Prevention, which is located in San Rafael. And the guy who started that and runs it is Professor Art Alman, who I think we've talked to you about before. He diagnosed the very first case of pediatric AIDS in the world back in 1983 at San Francisco General. So he's really one of the preeminent pediatric AIDS doctors in the world, and he's the leader of Global Strategies. They supported this young man who's just out of his pediatric residency at UC San Francisco, and they sent him over to Liberia for a year to make sure that this program went well. But, we took
I own a deal.
Oh, you do? Anyway, got a really good deal over there. We took over about 5 Dell computers that we taught them, how to use the computers, and also left them with thumb drives, or what do people call it? Flash drives? What
Flash drives.
Flash drives? Okay, USB drives, on which were loaded the very latest in medical knowledge from UC San Francisco on HIV/AIDS, which we were able to leave with each participant. So they have the very latest information on how to diagnose and treat patients and babies with HIV. This turned out to be one of the highlights of our workshop, because a lot of times people go over there and they'll use old technology or conference hall. We're conducting a workshop over the next 5 days. Who is that guy?
Art, there's no honorarium because you're working with Rotary. We have no money. We're all about raising money.
Who are these people here?
Oh, these are just some of the
workers. They're laborers. They're day laborers who brought in.
Well, yeah, they're working for that rate.
I get to be the chief of the chiefs.
Oh, okay. This is the registration table just before everybody comes streaming in. It's at 8:15 in the morning here. See, so this is Alan Varney, who's really doing everything basically to get this thing to happen. And here comes some of the first attendees in this conference, trainees from various clinics and hospitals around in and around Monrovia, Liberia. So this is the auditorium at St. Joseph's Hospital in Syncor, Liberia, where we're going to be holding the workshop.
So we sing this song. There was a man, his name was Joe. Praise the Lord. There was a man, his name was Joe. He was so sad he can't get well. Oh, no, I will not just know.
Dr. Sandy, over 8 years ago, here in Liberia.
The entire Rotary consists of about 1.3 million people all over the world. People like Liz and myself. And the power of Rotary is to have so many people coming together behind a cause. They can make a huge difference. I don't know if many of you are aware of the program.
Ready to play her role as a mother. During the 3 years of the traditional Sunday school, the women will talk about equal rights. That's when the women in Liberia, or at least my part of Liberia that I come from, had control over the line.
People, we are not going to eliminate our cultural practices
because of that. I think what we need to do is make our cultural practices safer. That's what we should do. We should put effort to do.
Also, people, we have a lot of good in our culture that I, for one, will try to maintain any way I can. But once it's harmless.
This topic is very, very important, and most
caring for someone with HIV/AIDS, as long as you're very careful of the products that come from the crisis, kissing, hugging, handshaking should be okay.
It's difficult to tell the partner, the next person, that your partner or your whatever has HIV, even if they refuse to do that. And why? Because we have to look at the other side of the coin. Who is your client?
And that's what we're hoping to do as we go forward with this project, is to expand it into all the clinics in Liberia, all the hospitals, and then from there go on to other African countries. Probably in conjunction with Save the Children. You know, under the Future Vision program of Rotary, they want us to ally ourselves with much bigger organizations and make a profound impact, like we did with polio. And that's what we're hoping to do here, starting in District 5170, and then see if we can't go out to a lot more districts. I've already started talking to districts in Southern California. The Inland Empire District has supported us to the tune of about $10,000. So we're going to keep trying to do that, but I need your continuing support as we move forward to our next step, which is to submit a $250,000 Future Vision matching grant. So that will involve us, Rotarians, raising about $160,000, and the Rotary Foundation would match with $90,000. So I'm just starting that now. I'm back here where I started, hoping that you'll continue to support us, and I'll be in touch with you. Any question? I know I'm out of time, but any questions, Church? That's probably the smartest thing to do, but the medical profession does not want to do that, because that only addresses the child's problem. I mean, you wouldn't have any infections of the children, but you still have mothers with HIV who don't know it and will die within a few years of giving birth. So the WHO's current approach, which we have to follow, is to try to treat the mother and the baby together as a unit. If you were only concerned about the baby, you would certainly try to do that, but that's not the way the WHO is moving right now.
Yeah, and the reason...
That's not a stupid question, that's a very smart question.
Yeah, the reason I ask is because your first comment was that not every woman wants to get tested because they have to be personal.
Yeah.
To avoid that, and not to have it tested and have the aid.
That's why that was one of my first questions when I started this whole project. Why don't we just treat every baby? But you still have the problem of the mother is still infected, and it's a lethal infection.
Your connection with Save the Children, at this point, I think we're talking about the kids that need to have medication all their lives because they missed out on it. You're talking about babies.
Yes, well, we're trying to prevent all those kids.
We're trying to prevent it, but there's a certain percentage that fall through the cracks.
Yes. Could
they not be adopted in terms of their medical costs for various Rotary groups?
Because they could be. You know, in working with Save the Children, I found that they're not big on. They try to keep the children in the community with other families.
I'm not talking about. I'm talking about adopting medical costs.
Oh, I see. Oh, of course. Yeah.
So if there were a vehicle, you know, I'd be today happy to take one child and support for the life of his life, whatever's necessary.
Yeah. You know, that's a wonderful sentiment. You know, the problem is trying to find the particular child you would be adopting. You know, and Save the Children found that was incredibly hard. And to maintain the accounting, to know that your dollar is going to that baby, turned out to be a nightmare from an accounting standpoint.
I would imagine.